Hey, it's April 6th, it's a new week, and we're trying something new. We're going to start every show by giving you a brief recap of all the COVID-related news you might have missed throughout the day before getting to our episode. So before we get into whether China's been underreporting the extent of its coronavirus outbreak, we learned last night that British Prime Minister Boris Johnson had been hospitalized because his COVID-19 symptoms hadn't improved. It was said to be a precautionary measure, but today we heard that he's been moved to the intensive care unit because his symptoms have gotten worse.
During the course of this afternoon, the Prime Minister's condition worsened, and on the advice of the medical team, he was moved in to a critical care unit.
On the Canadian front, today is the first day that people can apply for the Canada Emergency Response Benefit. The benefit will give people who've been forced to stop working because of COVID-19 up to $500 a week for up to 16 weeks, and that money should start coming in about 10 business days. And lastly, Canada's Chief Public Health Officer, Dr. Theresa Tam, just officially recommended that Canadians wear non-medical masks, like homemade ones made out of bandanas, for example, in public as a, quote, additional measure to help protect other people from catching the coronavirus.
It seems a sensible thing to do, so I think we recommend that Canadians can take this additional measure at instances where social distancing is difficult to maintain. So our strongest message really is that you must continue to do social distancing.
Dr. Tam urged people not to wear medical masks, though, like N95s, saying that those are better left for healthcare workers. Now, on to today's episode. So we know China's been ground zero for this pandemic. The virus is believed to have started there, and the world watched as it spread very quickly through Wuhan, and then as China took extreme measures like mandatory quarantines and travel bans and surveillance to contain the outbreak. And it seemed like these measures were working, while the number of cases around the world kept going up. Last month, there was a lot of optimism that China had gotten through the worst of it. But over the last couple of weeks, there have been a lot of reports that suggest we may not actually have a full picture of what's been happening in China, that they've been downplaying the severity of the outbreak there since the beginning, and that they've actively been suppressing information that makes them look bad. Today, we're talking to Global's Sam Cooper. He's been following this closely, and we're going to talk to him about why China would do this and what the consequences would be if it turns out that they have been lying about the extent of the outbreak there. I'm Tamara Kandaker, and you're listening to Wait, There's More. Hey, Sam, how's it going?
Not bad, you?
Good. Thanks for doing this. So I'll just dive right into it. So last week, Prime Minister Justin Trudeau was asked at a press conference whether Canadian leaders were getting the same kind of intel as the US that China, which is believed to have gotten its coronavirus outbreak under control, has been intentionally hiding and downplaying the extent of the crisis there. And what did the Prime Minister say when he was asked about that?
Well, the Prime Minister said, first of all, he didn't answer directly whether he believed China's numbers on coronavirus could be trusted, and he didn't comment on whether Canadian intelligence has provided any of the same assessments that the U.S. intelligence community is reported to have given the White House. His answer, I think, in the situation was understandably diplomatic.
Obviously, there'll be many questions as this is all worked through over the coming months and indeed years on how this was handled, what lessons are taken, who did well, who didn't do as well, and who was perhaps not as forthcoming with the global community as they should have been.
So it was a very diplomatic and rather lawyer-like answer. I guess we can understand as the world is scrambling for a supply of protective N95 masks, he wouldn't want to answer if he distrusted China's reporting.
Right. And our health minister, Patty Heidi, was asked the same thing after, and she said Canada relies on the World Health Organization to provide China's numbers to Canada, and that there was no indication that those numbers had been falsified in any way.
She was essentially asked, can you trust the World Health Organization's reporting? It seems they have lagged in certain ways and been very close to China's reporting. And reporters noted that she actually came back pretty hard at the reporter that was pushing that line of questioning and accused him of instigating conspiracy theories. And again, as you said, she maintained that Canada relies on the World Health Organization and trusts them, and that there are no indications of misreporting from China. But the problem with that is that that's provably false, because right from the start in China, there is open evidence that whistleblowers, including doctors, have been harshly suppressed and in some cases even disappeared. There's a lot of evidence, but that's some of the early strong evidence that China was not being upfront.
Yeah, and I want to talk about that in just a bit and how China has handled this. But just before we get there, you mentioned that the U.S. government received intelligence that China's numbers may not be accurate. Can you talk a bit about what the U.S. government has heard about this?
That's right. Bloomberg News reported just the last week that the American intelligence community had concluded in a report given to the White House very recently that China was intentionally underreporting their data. And there wasn't very much information on, how off China's reporting could have been done, or the method of misreporting, or who would be responsible. But certainly that report from Bloomberg News agreed with what I was hearing from a number of experts in Canada and the United States. What they were saying was, even private businesses such as hedge funds were doing their own estimates, because when they have a lot of money on the line in China and they're not believing the reports coming out, they have ways to estimate. So a number of people were skeptical, and now we know that intelligence has even greater ways than private sources to find out the truth. And they strongly, they believe China's wrong. And my information is Canada intelligence community likely would have had those same assessments.
Okay, and it's not only the U.S. that's been raising questions about the accuracy of China's numbers. Last week, the UK cabinet minister, Michael Gove, was asked about why the UK didn't have adequate testing, even though they knew about the first case of the coronavirus in China in December.
But it was also the case that some of the reporting from China was not clear about the scale, the nature, the infectiousness of this.
I want to just quickly go through how we got to this point where China is being accused of lying about its numbers. So the outbreak is believed to have started in China's Hubei province late last year, and since then, they've reported about 82,000 cases and 3,000 deaths of a total population of about 1.4 billion people in the country. And you mentioned there was some suppression of whistleblowers and things like that early on. Can you talk about all of that in a bit more detail?
Well, that's very important to look at, because open sources were indicating in December 2019, a small number of doctors in Wuhan were starting to comment on what looked like the reemergence of a SARS-type virus in Wuhan. And we know that within sort of closed social media circles, the doctors were saying it looks like a very serious and very infectious virus is emerging. But then China cracked down on these doctors, and even state media came out and said rumor mongers will be punished. We know that a doctor named Li Wenlian got a visit from China's Public Security Bureau, and essentially the police told him, you need to retract your statement or there will be serious consequences. He did. We know that there were other doctors and even social media journalists, independent journalists, who were making similar reports. Many of them, we're told to stop talking about this virus. And at the same time, video was emerging from China that suggested something very serious was occurring. We could see trucks rolling down streets, spraying what looked like streams of disinfectant. We could see that in late January, Wuhan went under a quarantine. Everyone was locked inside. So at this point, we can see that the growth of the virus is very steep, and yet people are being told it's not spreading rapidly in the community. By early February, it's clear that it is very serious. And mid-February, the whistleblower doctor dies. And so at this point, we can see that China has a very serious problem on its hand with social anger, and it can't be suppressed anymore, that a very serious virus is spreading rapidly.
Yeah, and I understand that certain numbers were being excluded from the official totals. For example, they weren't reporting on the asymptomatic cases.
That's right. As it starts to spread outside China, we can see that there's a different way of reporting among different nations. And people that aren't showing strong symptoms, perhaps, they're not suspected of being spreaders of the virus, so they're not counted within China. After the fact, now we see that China has said we're starting to count them. So that's another reason to question their data. But by early March, we can see that it has essentially changed from a China problem, according to China's statistics. It's now become the world's problem. We see hotspots like Italy and Spain, where they are doing much more broad counting of asymptomatic cases. And these countries rapidly start to approach China's totals. And eventually we see the United States approach and pass. At that point, there's another data point where experts around the world, analysts, are saying China, a country of 1.4 billion, reporting 82,000 cases, and it stopped somewhere mid-March. The rest of the world, it's skyrocketing. It raises the question, can China be believed? And at that point, experts in governments around the world are saying, I think we were misled and we haven't been able to react the way we should have.
So since then, China's been reporting that they flattened the curve, that they've contained the virus, and that they're starting to reopen.
Outside, life is slowly but surely returning to normal. 2 weeks ago, officials began to ease the lockdown in Wuhan, allowing some of the city's 11 million people to go outside for the first time since the 23rd of January.
In mid-March, we started hearing that the death count in China was down, that the case count had really slowed down. Can you talk a bit about when it started to look like China had really gotten things under control?
Certainly, I think you can timeline it pretty clearly. After this whistleblower doctor died in mid-February, we see a very strong information push from China's government that they are taking this extremely seriously. They start to have the problem under control. We could see analysts are looking at China's stats and noticing that on a daily basis, the rise in cases seems to be mathematically perfect. It's rising as if these are spreadsheet numbers, and at a certain point, it levels off and stops. So again, skepticism is raised. We see an article coming out of China where a number of nurses and doctors are shown in a line taking off their N95 masks. The message coming out of China is about spreading positivity. We are here to help the world. China has successfully stopped this disease in its tracks. And we're there, to help you. We're there to help Italy. And so at this point, people around the world, whether they're in intelligence, governments, or just externally looking in private companies, are starting to doubt and ask questions about, if we can't trust the numbers coming out of China on a daily basis, what does it mean? What do we need to do?
Right. And I remember seeing that video of the healthcare workers taking off the N95s and reports that they were shutting down the temporary hospitals that had been set up to deal with the outbreak. But why did people start asking questions at that point? Why did people start becoming skeptical about the numbers?
Just from talking to intelligence sources, they have their own ways of getting accurate statistics. There's a long history of medical intelligence, it's called in the United States. They look at everything from satellites that could show you smoke coming from crematoriums. They have human sources in and outside China. They have intercepted signals intelligences where they could get a sense of the real numbers of incidences and deaths in China and what that means for the rest of the world. Again, we have sources like hedge funds or analysts in business that are looking at available information on the ground in Wuhan. So China's government said only about 2,500, not only, it's a large amount, but 2,500 people in Wuhan believed to have died. But on the ground, people are noticing in Wuhan that about 3,500 urns reportedly are being delivered per day to 7 or 8 crematoriums in the city. And so people do the math on that and they extrapolate and say, well, that's adding up to about over 20,000 potential deaths per month over the past couple months in Wuhan. There was a report from Radio Free Asia that matched that kind of estimate. against an official source, an anonymous source from China's government that reportedly said roughly 25,000 people had died in the past month. So you put that together and people are starting to estimate it could have been 45,000 to 50,000 deaths within Wuhan due to the virus over the past 2.5 months.
Yeah, and these urns are on top of the stuff we already talked about, like not including asymptomatic cases in the total number of infections. And the other thing, which we haven't mentioned yet, which is that there have been people who've died with COVID symptoms before they were tested. So they weren't included in the totals.
That's right, absolutely. With so-called citizen journalists in China at a certain time in Wuhan were reportedly filming, trucks driving up to crematoriums, and they were speculating or suggesting there's a lot of bodies being delivered. Some reporters were talking to media, and then we see these reporters disappear. We see a billionaire in China that came out with a strongly worded critique against President Xi Jinping. The billionaire then disappeared. So a lot of data points, a lot of clues are adding up for anyone that can read in open source reports or in the media that there appears to be, we can't use another word except a cover-up going on in China.
We'll be right back. Sam, I know you've been talking to experts and sources within the intelligence community about this. What have they been telling you?
I mean, first of all, it's strongly believed that in early, probably January, the U.S. leaders were getting strong reports from intelligence saying that the numbers coming out of China cannot be believed, that this looks like a very serious pandemic threat. So you compare that to the information coming out of China and the World Health Organization. It's not until March when the World Health Organization says this is a pandemic. Late February, the World Health Organization is still saying we don't see strong evidence of community transmission. The sources were saying you cannot rely on the public health data to protect your societies. You need to be listening to intelligence, and intelligence is giving a very bleak picture. Beyond that, why does intelligence distrust China? A source from Canada told me there have been so many instances where China hasn't been honest, and it's not in China's interest to report accurately what's going on with COVID-19, because this is a once-in-a-lifetime risk. This is a situation which will change world economies. It'll change geopolitics. Whoever comes out strongest will have more influence in the world. So the intelligence community's assessment is really dangerous times.
And just unpack that for me a bit more. This idea that whatever country comes out of this the strongest will have more influence in the world. What would be the benefit for China of lying about how many cases and deaths there have been as a result of this outbreak?
Well, it's the multi-trillion-dollar question, but the first step is the intelligence experts say China's government is in regime protection mode. They had a huge crisis on their hands when, just from the example of the whistleblower doctor dying, we saw in media and in social media, there seemed to be a strong a burst of rage within a lot of Chinese citizens, essentially saying, we've been lied to. We could have stopped this in its tracks, but the government seemed to want to cover this up for potentially economic reasons. And because in China, what I've also been told is from a local level official to report a bad number, that could have very serious consequences on their career, even their freedom, possibly their life.
Yeah, so I've also read about this, how numbers and stats are really important in Chinese politics, and they're used to evaluate how officials are performing, essentially. So what you're saying is there is an incentive for officials at the local level to misreport how bad the situation is.
What I was told from intelligence sources is that absolutely, that their assessment is at the local level in Wuhan, there was a strong incentive not to tell the truth, not to say that they were going to be wearing a new SARS-like virus on their watch, because if they do so, it's very likely certain people will lose their careers, potentially worse. They don't want bad information going up the chain in an authoritarian government. And all kinds of misreporting could stem from that very original source, which is essentially you're afraid of reporting bad things to the person above you. He's afraid of reporting bad things to the person above him. And this goes all the way up to the leader, Xi Jinping.
I guess what I'm wondering is, why is there such an intense focus on China's numbers right now? Because undercounting seems like it's a problem everywhere, since there are asymptomatic cases everywhere and a lack of testing in a lot of places. So we probably don't know the full extent of outbreaks in many different countries. So why would it be a big deal if China really has been underreporting its numbers?
That's a good point. Looking at this in a balanced way, no country has a firm handle on this. Even within Canada, we probably have debates about which province is doing more tests, which province has their hospitals handling this crisis the best at this point. But there's a difference between an open democracy saying, we're struggling to get a handle on this, but we will honestly report our figures because we are all in this together. Our scientists are trying to work together to find a vaccine. Our hospitals are trying to learn from hospitals in other countries which have seen this wave earlier. But the intelligence experts say there's a big difference between catching up and getting your reporting clarified day to day, and countries such as Iran, they point to Russia, and first of all to China in this case, where the regime is not voted in or out. The regime stays there. There's just so many incentives to misreport from authoritarian regimes, and that's the big difference.
Right, but why is there so much anger towards China from people like Boris Johnson for allegedly lying about their numbers? Like, what are they relying on these numbers for, and why is it so important that they be accurate?
Well, again, with the World Health Organization involved, this is the organization that countries around the world are relying on for accurate data. So I would say there's anger at this point, not only towards China, but towards the WHO itself, which again, late February was saying there does not appear to be a strong community spread factor to this virus. So if we think about what are the consequences of early misreporting, early suppression of whistleblowers and information, first of all, this defines how public health in countries around the world will respond. If they believe there's community spread, this could lead to any number of actions as serious as stopping flights from various countries, as serious as stockpiling protective masks, stockpiling hand sanitizer, blocking the export of protective devices for your nurses and doctors from your country, making efforts to realign supply chains. And if you think about it, that is where we're at right now. We are told that there's essentially an every person for himself battle going on, just so you can have enough N95 masks for your doctors and nurses. So it becomes, is it a panic response? Or if you have the best information from the start, is it a collaborative and a well-planned response?
Okay, so I read this interview with an epidemiologist in Hong Kong who kind of disputed that the accuracy of China's numbers and the early reporting were very important because so many decisions were based on that information. And what he was arguing is that the case counts and death counts during epidemics are often misleading, and scientists know this, and they know how to work around it. And he was saying that we don't actually need accurate numbers from China. We just need to know how to interpret the numbers that are reported. What do you think about that?
I think it's a good point. I mean, there's examples in Hong Kong and Taiwan where they have such a close relationship to China that their response was looking at what's happening. They probably would have been saying, we don't need to know if there's 50,000, 80,000, 500,000 cases. We're seeing with our own eyes and with our sources on the ground, something very serious is going on, and there does appear to be community spread. Therefore, should we be taking stronger measures at the border? Should we be stockpiling N95 masks? Should we do contact tracing of anyone that comes into the country? So I think you raise a perfectly valid point. If your eyes and ears are telling you it looks very serious, do you need to know the actual number? I would go back to what the intelligence is saying. It's the first one. If your eyes and ears are telling you something is very wrong, that's what you should be reacting to. You probably don't need to wait for the numbers coming out of China, the WHO, or even your own public health agencies.
So is it possible then that the US government and the UK government, which have openly been questioning China's numbers, are using this as a way to deflect from decisions that they've made?
I think it's fair to say that elected governments will face very serious questions on, did they listen to their own intelligence sources? Could they have prepared for a pandemic in January and secured all the masks they should have? Could they have been working more proactively? Absolutely. And is there the argument that they're using China as a fall guy, so to speak, and blaming everything? Those are arguments that are going to be very front and center in the upcoming US presidential election. I've seen a number of reasonable analysts saying that it doesn't have to be one or the other. It can be both. Western governments probably should have relied on their common sense and intelligence and prepared much more diligently at an early stage. And at the same time, if you're starting from misreporting, bad numbers, and cover-ups coming out of Wuhan, China, there's no way you can look at that and think that that helps the rest of the world. So where are we from that? I think looking forward, right now it's just about saving lives. In the years to come, any number of analysts I've talked to say that we're going to see some major realignment in geopolitics, trade. Society will change wherever you live.
Okay, so if we're questioning the early numbers, should we be skeptical of China when they say they have it under control? Should we be concerned about them reopening their economy?
The experts that I've talked to say, look, it's proven now there was some form of cover-up at the early stages in China. No one could deny that. So what does that lead us to believe about daily reporting coming out of China? Certainly, there's no reason not to be skeptical. Has there been, increased cases in China? There are some indications. We can look at China taking very strong measures to block re-entry into the country of foreigners. We are told that inside of China, people are reporting being barred from going into certain establishments. So China is not acting in a way that this is totally under control. They are now within their own messaging, warning about reincidences or a second wave. There were reports that movie theaters across the country were closed. There are enough indications that it's certainly not finished in China. What that implies for the rest of the world, I mean, any analyst I've talked to, no one knows, but we could be in for a long haul.
Sam, thanks so much. We really appreciate it.
Thanks.
All right, that's the show. Thanks so much for listening. If you like this episode, please leave us a review wherever you're listening, and you can check out all of Global News' ongoing coverage on COVID-19 at globalnews.ca/coronavirus. I'm Tamara Kendacker, and I'll talk to you tomorrow.